Okay, so still got quite a fair bit of information to get through today, so apologies for that. Right, so we're finishing off the trusted assessor model. We've already looked at kind of managing outside, so we're going to just now move on to equipment for toilets. So we've already done the task about going to the toilet and how difficult that can be. Here, just looking at this picture now, what would be the concerns in this bathroom?
Is nothing that they can support to stand.
No. Yes.
Dangerous with the towels could slip.
The towels are, yeah, a hazard over there.
Yeah, so we've got some risks here. We've got the towels. Equally, we've got that thin towel rail, which could be used as a rail and could come off the wall and cause a problem. The doors in front of them, so if they go forward, they could hit it.
Toilet paper's quite far behind.
Toilet paper's behind them, so how are they going to do personal cleaning? Again, there's clutter all on the toilet, so if they try to reach those wet wipes, it's going to be difficult. So again, lots of things there to consider about when we're promoting independence and keeping care safe. So as we said, toilets should be measured in the same way that we measure seats. So we should still have the 90-90 degree, and we should have that fist bump either side of our bottoms to make sure that we've got enough room to get off the toilet and on the toilet. And traditionally, toilets are quite tightened places, aren't they? They're quite cramped normally. So if we look at this toilet, what's the concerns here?
Too narrow.
It's very narrow. What else?
Towel rail that could burn them.
Yeah, so the towel rail, so you've got a heat thing. And again, that's something that they could use to pull off the wall. What else?
Toilet rolls.
Toilet roll.
Toilet rolls are all behind them. So this is really good because where we're at now, we're starting to see the environment going, is this an appropriate environment? And actually, we could make it safe quite quickly. We could get the toilet roll holder at the front. We could get a rail to go around the toilet to make it easier. Or alternatively, we could just change or adapt. So there's lots of toileting equipment. You've got the kind of frames that go around the top of the toilets, which is the top left. You've got the toilet seat. We get rid of the lid, and therefore it saves us pushing the lid up or down. So if we've got mobility problems, we could just use that. If we need the razors and a bar, we've got the razor, toilet seat with the bar, or we've just got the razor seat. Again, you've got the bar with the razor, or alternatively, there's our old-fashioned commode. But again, thinking about the commode, it has a lid, it has the seat that you have to take off, and the toilet seat with the bowl lid. So lots of things that could disenable somebody where we think we're enabling them. So we just need to think about the equipment in which we're going to use. What is the most appropriate one for this person? You are meant to be able to demonstrate fitting a plastic toilet seat. I don't know if any of you have got those in your homes. If you haven't, I will eventually bring one round for you all. I'll show you how to put them on and off when I come around and do your placement, your face-to-face observations. So, principles for rails around toilets. Grab rails should be used to push up and to pull up with. So what we're saying is a grab rail should be fitted in the direction of travel. So if you're going to stand, it should be sloped, but if you're going to hold, it should be straight. Normally plastic non-slip with the kind of ridges around the side. And obviously there's lots of information to refer to in your books. Now, when you measure up for a diagonal rail, this is how you measure up. So there's two ways in which you can measure. You sit the person in their 90 to 90 degree angle, and you get them to put their arm forward, as pictured by the lady, and wherever their hand is the direction of the rail. Okay, so that's the first way to measure the right height. And it should be the lower part of the rail should hit kind of almost the elbow. Or alternatively, you've got the rail that's close to the toilet seat, and that's where it comes off the elbow and down the knee. So off the elbow, down the knee, center point to the wall is where the center point of that rail should be, because there should be enough movement on that rail to pull yourself up. Okay, so it needs to be at the right height. Again, we talked about this earlier. If somebody needs to go to the toilet, to stand up to urinate, you're going to measure from the hand heights to where they hold, across and down from where they urinate, and that's where the bar should be, and it should allow a bit of movement up and down. Okay. Again, all of this is in the book, so you don't need to worry about this. If you were to do an assessment on rails, you've got this information to hand, so you don't need to remember all of this, you just need to know where it is. Equally, we have the drop rails that come down to the side of the toilet. And again, they can go up or down, so they're quite useful because it's not a bulky bit of equipment. You can use the up or down rails, and you normally see these in disabled toilets. And obviously, it enables that flexibility for everyone else. Finally, looking at coloured aids. So again, this toilet is perfect for somebody with dementia because it's bright in colour. So somebody with dementia can see the positioning for all of those rails. And they can see the toilet seat raisers and the bars. So if a toilet was all white, it causes a problem, doesn't it? So what's the problem with this bathroom then?
There is no rails.
So there's no rails. But imagine
Toilet roll holder is miles away.
Yeah, toilet roll holder is a mile away, yeah.
Seats very low.
It does look like quite a low toilet. What else?
Hand wash is right up on the shelf of the window.
Difficult to wash, yeah. Something else? So what's the colour of the bathroom?
It's completely white apart from the black tiles.
There's no colour.
No, there's no colour. So it makes it difficult for somebody with a visual impairment or dementia. This is a bathroom nightmare. It's going to be really difficult to coordinate themselves around. So again, simple adaptations, just a bit of colour, few rails, makes it a usable bathroom for that person. Without it, they don't really know what they're doing or where they're going. So what we're saying is simple adaptations promotes independence. So bathing equipment. So there's lots of things that we can do for bathing equipment. Okay. So bathing equipment, we're looking at bath boards. If we use a bath board, they need to have that 25mm space either side of the wall so it moves, and they're just fitted in nice and easy. And you'll see you've got some bath boards with a rail, so it means that I can sit on that bath board, hold the rail and slide myself over, or alternatively you've got them without the rails, and again that you can have a rail on the wall. And the one down at the bottom, you can see it's got the red rail, so that's perfect for somebody maybe with dementia or a visual impairment where they've got a nice high spectrum colour for them to use it. Equally, bath seats, we've got different types of bath seats, lots of different types there. Again, you would look at the benefits for a bath seat. And the reality of the bath seats is actually, it's, yes, you can sit somebody in the bath, give them a shower or wash, but it's not like they can submerge themselves in water. So again, they still need a bit of upper body strength to help get themselves out of the bath. So if you're thinking about those, and I know most of you now in the modern bathrooms, you have all of the electronic devices. However, if you haven't, you've got the swivel bather, which goes around and they can sit on that. There is a bath lift, which you can get from local authorities. Again, that's just like your typical bath lift. The problem is it takes up a lot of space in the bath, so it doesn't submerge them properly. Or alternatively, there's the bath cushions. And that's like those inflatable ones that come up or down that you can use for people with poor mobility. So grab rails at the sinks. So depending where you're going at the sink, again, you need to think about the tactile and where you're going to hold. So again, for hand washing and personal hygiene and brushing teeth, maybe you need a grab rail, maybe you need a purchase and install, but there's lots of things that we can do to make that environment more user-friendly for the people we look after. Equally, step solutions for bathrooms. There are steps that you can get to help people get in and out of the baths, because actually they can be quite challenging, can't they? They are quite high. No, we're not going to worry about that. We're not going to worry about that because you will cover that later on. So mobility aids. In social care, we use a lot of mobility aids, and it's down to us to make sure that the person's using them properly, that they're using the right equipment that's prescribed for them, and that the rubber feet on the end are fit for purpose. So the way in which we measure a mobility aid. So you can see for the crutches and the Zimmer frame, the wrist should be flexed, and depending on the size of the wrist is the height that it goes. So it's the wrist to the floor. So that's when we measure for mobility aids. So if you've got spare Zimmer frames or walking sticks, and you've got something you think you need a frame, you can measure from the wrist to the floor. Granted, it is an OT skill, but as a trusted assessor, you know how to measure up and obviously make sure that you've got the right equipment for the right person. Finally, promoting independence in people's homes or in care homes. Let's say you've got little Margaret, she's got her medication, she's got her clothes that she wants to put away. If you had a little trolley, she could put all her stuff in a little trolley, whiz it around her room and work from her trolley. So it's about empowering her to still live independently, even in her bedroom. And a little trolley like that really does give a lot of independence. And again, she could put a cup of tea on that from the dining room and take it back to her bedroom. She could get her washing from the laundry. She could get her meal from the kitchen. There's lots of things that little Margaret can do with this trolley. So assistive technology, again, lots of different assistive technology out there. And that could be things such as alarms and sensory mats, alarms if people fall, or alternatively just using the new iPads and Google devices or whatever to be setting reminders and promoting independence. And again, I think care homes have really stepped up over the last year in using assistive technology, because people have been doing Zooms and WhatsApp calls to their loved ones and relatives. And actually, it took a national outbreak of COVID for us to get assistive technology into care homes. But now it's there. I don't see it coming back. I don't see us taking it away. I only see us improving and moving forward with assistive technology. Ordering and receiving these services. So basically, when you become a trusted assessor with your local borough, you finish off your training, you get a certificate, you can register with your local borough and say, look, I'm a trusted assessor, here's my certificate. And they'll be able to give you a login to their system. Normally it's called ELMS. And in there, if you're allowed to do so, you can order the equipment that you need for your people that you look after. If, however, you can't do it because they say no, at least you know that you can measure up equipment and order equipment on behalf of somebody and send a request to social services and say, look, this is the stuff we need. Equally, if social services come back and say no, you can then show evidence to CQC that you've tried, but then maybe there's a thing around finances. So maybe they've got their own direct payments, so they could pay for that equipment or adaptation that makes their life better. Alternatively, maybe you can get it from a loan service. So there's lots of ways in which we can help people to get this equipment. Was a whistle-stop tour, that one. And you do trusted assessor training in full, much further down, but this was all about enabling people. So from that model of enablement, can we see things that we can improve in our practice? Do we find that session useful? Or was it stuff that you already knew?
No, it was useful, and I did learn a lot of things. Thank you.
Yeah, I think what this does is it just brings us back to the basics, doesn't it? Where we're so task orientated that we forget that sometimes just the simplest of things we can do can make a huge difference. And when CQC come in and they say, how do you promote independence? How do you enable people? You can now give lots of real strong practical examples other than, we let Mary pick her clothes, which seems to be the #1 answer. Right, so I'm going to stop that session there.